Most people hear the words glucose, insulin, and diabetes, but don't really understand how they work together. In this video, I'll break it down into the simplest way possible so you can take control of your health, prevent complications, and live better. What if I told you that the difference between good health and diabetes complications comes down to just one hormone and one type of sugar? Let me explain this in the simplest way you've ever heard. Let's start with glucose. Glucose is simply sugar in your blood. Every time you eat, especially foods like rice, bread, garri, yam, sugary drinks, your body breaks them down into glucose. Think of glucose as fuel. Your body needs it for energy, to walk, to think, even breathe. But here is the problem. Too much glucose in your blood is dangerous. Now let's talk about insulin. Insulin is a hormone made by the pancreas. Its job is simple. It acts like a key. It opens your body cells and allows glucose to enter. So, instead of staying in your blood, glucose goes into the cells where it is used to produce energy. Let me make this very clear. Glucose equals to fuel, equivalent to petrol. Glucose equals to fuel. The cells equals to the engine where energy is produced. Insulin equals to the key that starts the engine. So without insulin, which is the key, the fuel cannot enter the engine. Now, here's where diabetes comes in. Diabetes happens when this system breaks down. There are two major ways this can happen, producing majorly the two types of diabetes. Type 1 diabetes. The body produces little or no insulin. Remember that insulin is the key. So when there is no key, glucose cannot enter the cells. So glucose stays in the blood, which leads to high blood sugar. Type 2 diabetes, more common in adults. The body still produces insulin, but the body does not respond properly to the insulin produced. The key is there, but the lock is faulty. This is called insulin resistance. When glucose stays too long in the blood, it starts to damage tissues and organs. The blood vessels, the eyes, the kidneys, the nerves, and the heart are only but a few of the organs in the body damaged by high blood sugar. That's why people with uncontrolled diabetes can develop stroke, kidney failure, blindness, and foot problems. Here is the truth many people do not know. Diabetes is not just about sugar, it's about how your body handles that sugar. The good news, you can control this system. And here is how. First, eat balanced meals. Reduce excess carbohydrates and sugar in your meals. Secondly, exercise regularly. This improves insulin function. Thirdly, maintain a healthy weight. Take medications as prescribed. Then monitor your blood sugar as regularly as possible. The goal is simple. Keep blood glucose in the blood as normal as possible. help insulin work effectively. So next time you hear your sugar is high, you'll understand exactly what that means. Not just glucose, not just insulin, but how they work together to determine your health. If this helps you understand diabetes better, like this video, share it with someone who needs it, and follow for more simple health education tips. Subscribe to our channel just so you don't get it all mixed up again. Remember, glucose is the fuel, insulin is the key, and diabetes happens when the key stops working.